Con talked about a proposal for global budgeting of hospitals, and some of us in Bernie's office and elsewhere have been working on an approach that we're shopping with the legislature right now. I happen to believe that we can do global budgeting for hospitals this year. We don't have to wait for the gubernatorial election. We don't have to wait till the year after. We can do it this year. It would save us this year $150 million just this year in administrative expense from the current fee-for-service time and material system in hospitals. That would generate enough money so we could hold the line on the last hospital rate increase, which was $100 million, and provide coverage to all uninsured Vermonters this year without additional taxes, without additional premiums, without additional money. And if you're talking about an economic development program, folks, how are we going to say small business in Vermont? Half of Vermont workers work for firms with 25 or fewer employees. We would be able to save, as Senator Ash said, $1 billion between now and the time the federal legislation goes into effect, assuming it passes in 2013 or 2014. That's $1 billion. That's real money. In fact, I was having lunch on the marketplace last summer, and the speaker came by, and it was right after they had the last vote for the $26 million rescission. It was the $26 million last cut. And I said, Speaker, I said, do you know how much healthcare spending is $26 million? Anybody here know? It's a day and a half. They all agonize over $26 million in tax cuts and service cuts in the state legislature. Folks, it's a day and a half's worth of healthcare spending in Vermont. We're at $5 billion a year, and our spending has gone up by $2 billion a year from the time when Jim Douglas took office, and then it was just under $3 billion a year. To me, if we're talking about health, we're talking about economic development and how we get the state moving, the key in my mind is healthcare reform. It's the hidden tax. Employers who are providing insurance now are paying 14% of their payroll in insurance premiums. Think about it, you know, oh, Social Security, it's such a burden, blah, 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 blah. Your combined FICA withholding is what? 7.5%, double that. That's the healthcare burden on employers right now. Through global budgeting of hospitals now is something we should be fighting for now, and we can begin to save real money now. And the link between that and Burlington Telecom is this is the group that thinks outside the box and has the nerve to do it, and God bless you for it, and let's keep doing it.